Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is fatal child abuse. Now, whenever we are referring to fatal child abuse, it's basically the child category basically involves the neonatal period as well as the infancy period and as well as the adolescence period. So neonatal period is basically defined as 24 hours after birth and infancy is less than a year after birth. So this period is basically defined as the infancy and the adolescent period is till the teenage period, that is almost 13 to 14 years. So this is the definition basically of the children that we are talking about, and they can be subjected to fatal abuse. That is an abuse that can lead to the death of the individual. So that is what we'll be discussing over here in this lecture. The subsequent sections, basically the first section comprises of the modes of death and the surface bruising. So the general aspects and the modes of death, they are described over here. What are the underlying causes of death whenever we are talking about the fatal child abuse? All of this will be described over here. Moreover, we'll be discussing the surface bruising along with it. So it is very important that these surface bruisings are also known as the six-penny bruises or the discoid bruises. The six-penny bruises, this name was given due to their shape and due to the digital pressure that is applied during the abuse, and that leads to the formation of such kind of bruises in the child abuse. Moreover, we'll be discussing the age of bruise and how is it identified, that how much time has passed on since the bruising has occurred. So this is basically the color changes that occur in the bruising phenomena that leads to an information which gives an information regarding the age of the bruise. Whether it's 2 days or whether it's 3 days, it depends upon the color or the color formation and the pigment formation in the bruised area. In the second section, we'll be discussing the skeletal damage. So the abuse can be hard enough, or the infant or the child can be subjected to such a harmful abuse that it can lead to skeletal damage. That basically refers to the fractures and the different kind of fractures basically they're involved in it, depending upon the type of abuse that the child has been subjected to. So the dating of the fracture is again very important over here, and we'll be discussing that over here as well. Dating of the fracture is basically, it is the whole information that is gathered at the crime scene, and as well as after the radiological examination, the dating is fixed according to the amount of damage that has been caused to the bone, to the underlying bone. So the bone diseases, a lot of metabolic diseases and a lot of genetic disorders are there. So we'll be discussing that as well. And the infant fractures, they're also discussed over here in this second section. Moving on, in the third section, we'll be discussing the fatal injuries as well. The head and the visceral injuries are discussed in detail over here. The damage to the eyes, the ears, and the mouth, it's very evident when the child is subjected to such a domestic violence or such an abusive environment. So if it is suspected that abuse has occurred in a particular case, you have to have a particular clinical examination, and if it's a dead and we're performing an autopsy, then there should be a complete examination of the ear, the mouth, and the nose, etc. So burns, some children are subjected to burns, the hot temperatures, it can be scalds, and bite marks are also important. They have to be looked for, and they're again pointing out towards specific kind of a domestic violence. And other injuries are also included in these fatal injuries. There are different methods. It can be an asphyxiating death, it can be a traumatic death. And all of this will be discussed over here. What are the findings in such a death? That will be discussed in this third section. Finally, in the fourth section, we'll be discussing the autopsy features. So first of all, the external examination, as it is a routine to carry out a complete external examination in any case of an autopsy. What are we looking for whenever we are suspecting a case of child abuse? What will be the features that we'll be looking for? That will be discussed over here. And then moving on, we'll be discussing the internal features specifically relating to the child abuse. What will be the particular features, for example, a lacerated liver, for example, the hemoperitoneum, all of them will be pointing towards the child abuse. So I hope you want to learn more about this fatal kind of child abuse. So do watch the other sections to this lecture as well.